With respect, Mr. Speaker, there is no rule in this House or in the British parliamentary system against interjection. Whenever Alberta's NDP challenges the healthcare privatization of the health minister, he responds by claiming that our opposition is based on mere ideology. He ignores the fact that all reputable studies show that private healthcare delivery costs more and has worse outcomes. Now the minister's chickens are coming home to roost. Just yesterday, he blamed one of his private companies for their inability to deliver home care services to those that need them. Will the minister now admit that his
honourable member of the front bench? 35 seconds are up. I'm sorry. Mr. Health.
Mr. Speaker, it's difficult for me to understand what this honourable member is getting at. What I've been saying and what I will continue to say on behalf of this government is that the bottom line in any circumstance in the delivery of health care is quality of health care, Mr. Speaker. And that is, we are indifferent to the quality provided by public and private and not-for-profit providers so long as all types of providers adhere to provincial standards which are rigorously enforced. That, Mr. Speaker, is what creates a high-performing health system. That's what allows us to deliver health services to growing numbers of citizens.
Honourable member, first up.
Thank you very much, Mr. Speaker. This minister's ideological commitment to privatizing our healthcare system is putting our seniors at risk. Seniors are dying in the care of companies who are more interested in profit than care. Seniors' care is chronically underfunded, and seniors are left lying in their own waste. When will this minister admit that his underfunded, privatized model for seniors in care is not working and take real measures to ensure the comfort and dignity of every senior in this province?
Mr. Speaker, every day in this province, care of the highest quality, and that would be the envy of many in this country, I dare say, is delivered to hundreds of thousands, if not millions, of Albertans. Mr. Speaker, in any large system, in any system that is growing as the rate that Alberta is, there are bound to be issues on a day-to-day basis. The bottom line, Mr. Speaker, is that quality trumps all, that we have common standards that apply regardless of who the provider is in a given situation, that we monitor for compliance with those standards, that we report on that performance, and that we learn from it, Mr. Speaker.
Honourable member.
How many seniors are going to die in care while this minister learns lessons? Why doesn't this minister admit that these are not just rare and one-off occasions, that in fact all of our seniors' care in this province has serious problems, mostly due to very short staffing? We've tabled in this House over thousands and thousands of working short forms describing individual situations where seniors didn't get the care they needed. When will this minister take responsibility and actually do something?
Mr. Speaker, the honourable member can say what he likes. The fact of the matter is that we have strong provincial standards for quality in the province. We have challenges, as we have discussed in this House, in the back and forth of question period with respect to the increase of the number of residents with dementia and Alzheimer's disease and other ailments. We have acknowledged the fact that people enter facility-based care at an older age, 85 today in Alberta, and we have acknowledged that their demands, their health care demands, are much more complex than they were even 5 years ago, Mr. Speaker. We are taking the appropriate steps in adding capacity for additional beds. We are keeping up with staffing requirements where we're matching.
Thank you.